The recent high-profile cases of donated organs after severe auto accidents have raised public awareness of this life-saving gift from the victim's family.
While organ transplantation has become more common, certainly many of us still have some questions about how it happens exactly and how decisions are made to use those organs and where they go. Dr. Dianne McCallister, the Chief Medical Officer at Centura's Porter Adventist Hospital, joins us every Wednesday to help us tackle these topics. So transplants are great gifts, certainly, to the recipient. What tissues exactly can be transplanted?
The number of tissues that we can transplant have really grown, and in addition to the things we think about like heart, lungs, liver, kidney, intestines can be used, eyes can be used, skin, even tendons and soft tissues can be transplanted to help people with certain conditions.
So remind us, how do donors choose to donate organs?
So there are a couple ways that donors can put themselves forward. The first is, as in Colorado, you can designate yourself as an organ donor and it's put on your driver's license. That is like a will, and so it's a legal document when you have that on there. In addition, we ask families at the time of death if they would like to donate their loved one's organs, because oftentimes it's a closure that takes a tragic situation and can bring a little light into it.
Yep. So if everybody's willing to go through those steps and do that, what kind of testing is done on the donor to assure these organs are safe?
So there is a lot of testing done on donors. First of all, they cannot have cancer and they can't have an infectious disease at the time of their death. The second thing is then we test for things like HIV and hepatitis to make sure there's nothing transmissible. And then, of course, the organs themselves are evaluated to make sure that they will function in the recipient.
Okay. Now, a lot of attention is paid to the psychological aspects, the psychological issues in a donor and a receiver kind of a situation. Here's a hypothetical for you. What if a donor were known as a racist? Would that impact where his organs would go?
There's a system for distributing organs that is done in a, what I would say, rather scientific, factual way. And so the organs go based on a list of recipients in need, and the recipients get categorized higher on the list based on how sick they are and how long they've been on the list. So it's all done in a very mathematical, scientific way to avoid a lot of complicated questions and to make sure that those who have the most need are going to get organs first.
So it's totally objective, it sounds like.
Exactly.
Yeah, so once they make that match, what do you do to prevent rejection?
So there are quite a few things done. First of all, before they transplant the organ, you test for blood compatibility and antibodies. And then after the transplant, the people are committed to a lifetime of anti-rejection drugs, and they're followed on a routine basis, depending on the organ, to look for signs of rejection and change the medications to kind of stomp that out before it happens.
Okay. And are there other options for donating other than in death?
Well, you can choose to, before, it's not just in a tragic death that you can donate. Every death in the state of Colorado in the hospital, we have designated requesters that go and approach the family, and we're legally obligated to do that, and people come and make sure we do, because a lot of people don't realize that even elderly people can donate things like eyes and skin, and it's very useful and can help someone else.
Okay.
And then there are live donations as well for certain organs.
There are. For kidneys in particular, people can choose to be living donors, and this is generally someone who's doing it on behalf of someone they know.
Okay.
All right.
Yeah. All right, Dr. Dianne, thank you. We appreciate it.
Welcome.
Well, you can find all of the doctor's advice on thedenverchannel.com. Just click on the red TV button and look under Wednesday's links. Now for a look